but the complex ones. They will make your stomach larger, so after the bariatric surgeries,
some of our patients will say, I would just ask, but I want to be private, so.
You can do swimming, cycling, yoga, on the ring, on the television. Hello everyone, today we are here with the new episode of All About Health, and we are here with Lyly. She prepared me some questions, your questions actually. We will answer your questions today.
Yes, that's correct, and welcome guys, and thank you so much, Christophe, because we have our dietitian today, because definitely you heard it, it's about health or health, like I like to say. And so Christophe, I kind of took a few days to ask to our patients, well, those who have already had our surgeries done, bariatric surgeries, particularly they have it done many years, many months ago, few days ago, and also some of our patients who actually are planning to come to Istanbul to have their surgeries done. And eventually they do have so many diet questions, right? Questions about how to eat, how to basically have a very healthy lifestyle. So I'm gonna use my phone today because we chat and we discussed, and they sent me a few of their questions. So of course, guys, we know that videos can't be that long. So I managed to kind of just select few questions that I think are very, very important for a patient to know, and those of you guys who just have, different questions about nutrition and who would like to come here and have your surgeries done. So first question, I'm going to start with, is it possible, Christophe, for a patient to consume carbohydrates after a bariatric surgery? And so if so, which type of carbohydrates are best for us? Well, for you guys.
Okay, so carbohydrates. We need proteins, vitamins, minerals, and carbohydrates as well. But after the bariatric surgeries, our first objective is losing fat. So that's why we start with diets that contains more proteins and vegetables. And vegetables contain carbohydrates as well. But the ones that we need for the first period of the after bariatric surgeries. So when we talk about carbohydrates, the bariatric process is a long process. So, like I said, our first objective is losing fat. But after reaching our objective will be gaining muscles.
Okay.
And that's the period that we need more carbohydrates. But which type of carbohydrates? We have different types of carbohydrates. The complex one and the basic ones. So the basic carbohydrates are increasing our glucose levels very fast and decreasing very fast. So they can cause fatigue and we cannot have enough energy during the day.
Okay.
And that's not the healthiest option for our body. But the complex ones, they are not increasing the glucose levels very fast, so we have a more balanced glucose levels during the day. So we need to always prefer the complex ones after the bariatric surgeries and when we are closer to our objective. So after the 8th month, 9th month, or the first year. It can be different for everybody, so that's why it's very important to be in contact, in touch with our with your dietitians.
Yeah, okay, got it, perfect. Now, we have spoke about, carbohydrates. Now let's go to our other questions, which is our question number 2. Is it possible that our patient drink carbonated drinks?
So these drinks, fizzy drinks, like different drinks that contain gas, after the bariatric surgeries, they are not healthy, and not just for the patients that had bariatric surgeries, for all of us actually.
True.
They are the ones that we need to forget about it.
Yeah.
Because they will make your stomach larger. So after the bariatric surgeries, if you want to keep the effect of the surgery for a longer time, it will be better to avoid fizzy drinks. And at the same time, they are not healthy for us. You will have a very small capacity after the bariatric surgeries. So if you fill your stomach with these kind of drinks that contain nothing, only bad ingredients, so that will not help us for the weight loss, and you can have serious vitamin and mineral deficiencies.
Okay, got you, thank you. And another patient of ours, basically, she asked, I'm pretty sure she has already, or he has already done the weight loss treatment for sure. So I won't say if it's a she or he, because we're trying to keep, some of our patients will say, I would just ask, but I want to be private. So
Yeah.
anyway, so our beautiful patient asked this: when can I start sport and what type of sport I can do?
Yeah. So you don't have limits after the bariatric surgeries. That's the good part actually. The first month we need to keep walking, only walking. But after the first month you can do all the sports that you want. You will not have any limits. You can do swimming, cycling, yoga, pilates, you can go to fitness. You will not have any limit with weightlifting. Just we don't want you to do boxing during the first 6 months. We don't want you to see on the ring, on the television. So that's it actually. But we want you to find something that you like to do continually. Because the most important is keep exercising during this process. So you need to find something that you like.
Thank you.
Yeah.
Got it.